Good morning, everybody. I'm Sandra Arevalo, and I'm the Director of Community Health and Wellness at Montefiore Nyack Hospital, with you again in this rainy day from Nyack, New York. But today we're going to be talking about menopause. And I know that a lot of people have been asking about this, women in particular, of course. So we found a doctor that is brave enough to come to us and comfort us and tell us about menopause and everything that we need to know about it. Because as we know, a lot of us might be going through it or starting to go through it, but not everybody likes to talk about it. So, Dr. Kinrek, thank you so much for being with us today. Dr. David Kinrek is from Highland Medical. That it's part of Montefiore Nyack, is part of our outpatient services. And Dr. Kinrek, you are an OBGYN, correct?
Correct.
Yes. So thank you so much for being here and for doing this for us. We have a lot of people listening to you right now, and I know that you have a presentation that we're seeing right now. So feel free to start anytime you like.
Awesome. Thanks for having me. It's a pleasure. And I'd love to teach the community more about menopause and you. And I would love breaking the silence about menopause, the title of the lecture. As Sandra said, I'm an employee by Hyla Medical. I also work at Montefiore Nyack as faculty. And I'm going to share with you guys some of my experiences and about menopause and what I see in the office, what people ask. And at the end, I'll try to give you some time for some questions as well. So moving to the next slide, disclosures. I have no disclosures. I don't get any money from pharmaceutical companies or anything of that sort. So let's start.
Dr. Kinrak, your audio, it's off.
Can you hear me?
Now we can, yes.
Okay. So let's start with terminology. Menopause is meno is for months and pause is for cessation. So when your periods end, that means menopause. So natural menopause is when all your periods ends, and that's because that happens because you lose ovarian function. The ovaries stop working. Now, menopause is a wide range, and I'm just going to go through a little bit of the it doesn't you don't go from having periods normally to not having periods at all. It goes in stages. So the first stage is perimenopause. You start having menopausal symptoms, and there is early menopause, which can start at age 40 to 45. Normally, it doesn't start until 47 about. And then you have late menopause, which is when it starts very late. It starts after age 54. And then you have premature menopause, which starts earlier than normal, and that requires a more extensive workup, and that's before age 40. Postmenopause is the end of your periods, but it's after 1 year, 12 months, you don't have any periods, you can confidently say you're in menopause. So as we discussed, the average age is 51. Again, for the participants who want to know when menopause starts, it's usually 51. But you can also, it is genetic a little bit, so you can also ask your mom or when they started menopause, and sometimes that correlates when you're going to start menopause. So 80% of women who go through menopause have symptoms. However, interesting, only 20% seek treatment. Symptoms can last up to 4 years. Small percentage can last up to 12 years, but usually it's about 2 to 4 years maximum. But if you think about it, 30 to 40% of your life is in menopause. And there's a wide range of symptoms. And this lecture is not to um, is not is just to give you an overall view. It's not, everyone's different and everyone requires a different treatment regimen. So this is just an overview. So as we discussed, perimenopause is age 40, usually starts age 47, and the average age is 51. And normal duration, everyone's different, but it can last, as we discussed, up to 12 years. So how do we diagnose menopause? So usually we diagnose menopause, the diagnosis is clinical. You don't have periods for 12 months, 1 year, we can confidently say you're in menopause. A lot of my patients say, well, doctor, do you want to do blood tests? Normally, I only do blood tests if there's a question. If they're younger, they're like less than age 45 and we're not sure. We want to see if there's maybe they have hot flashes. We want to see maybe there's a thyroid issue, maybe there's something else going on. But if they're at age 51 and they haven't had periods for a year, we don't need any blood work. We can say you're in menopause. So why does menopause happen? So menopause is a natural process, and basically the ovaries stop producing estrogen. That's what it boils down to. And if you don't have estrogen, then you're gonna have a lot of symptoms, and you're gonna be in menopause. You can also induce menopause. You can get menopause when you have surgery. You have a hysterectomy, and the doctor takes an ovary for whatever the reason is, or you have chemo radiation, and the ovaries aren't working. You're gonna become menopausal. So, what are the hormones that are involved? The main hormone, the main culprit, is estrogen. A decrease in estrogen will um, uh, will make you menopausal. There's also a decrease in progesterone and testosterone. So when we talk about hormones, what are hormones? Hormones are chemicals that send messages to every part of your body to do something else. And the disruption of those hormones causes all your symptoms. And that's what happens. So on this slide, you can see the stages of menopause. As you can see on the left side, you see there's a decrease in estrogen level, and it goes down slowly. It doesn't stop from high estrogen to zero estrogen. It goes slowly. So as the estrogen decreases more and more, the more symptoms you have. So perimenopause occurs in the mid 40s, and normal periods last between 25 and 35 days. And then all of a sudden you see your periods start winding down. They last longer, and then sometimes you skip periods. And then all of a sudden you notice you get hot flashes, night sweats at night. And that's how you know you're in that perimenopausal range. So there's two kinds of menopausal symptoms. One that's essential, systemic, that affects your whole body, and that's hot flashes, sudden intense heat that you feel that can last up to 5 minutes. You can have a lot of variety of symptoms, mood changes, you can have your aches, you have your joints start to ache, and I get this all the time. Patients complain insomnia, they cannot sleep well. They get headaches because a lot of headaches are related to estrogen. Dry skin, again, decrease in estrogen, decreased libido, and forgetfulness. Now, not everyone experiences everything, and some women don't experience anything. So everyone's different. And these are the seven dwarfs of menopause. And again, everyone is different. So what are the local effects from menopause? You can have lots of vaginal dryness, and interestingly, the urinary system is very related to the vaginal system because when you're born, they develop from the same tissue, so they have estrogen receptors. Meaning, if you're gonna have a decrease in estrogen, you're at increased risk to having more urinary infections, UTIs, and you can also have incontinence, meaning you have to go to the bathroom a lot and you cannot control your bladder. And these are local effects, and they're treated differently, so that's why I separated them systemically and locally. So how do we manage the menopausal symptoms? So the first thing I tell my patients is lifestyle changes. You have to avoid hot and spicy foods and open and close windows when you have these hot flashes. Um, you want to avoid extreme hot, extreme cold drinks. And you also want to wear cotton clothing, layered. You want to use fans as needed. You definitely want to reduce your alcohol intake and caffeine. You want to exercise regularly, and you're losing weight has shown that it helps. And sleep. Good sleep, a good night's rest can cure a lot of the symptoms. So what are the non-hormonal things that you can take? So there's a company, again, I'm not here to promote any company, but there is a company, Bonafide, that has non-hormonal treatments for all kinds of menopause. And some studies have shown acupuncture, yoga, pelvic floor therapy can help. In general, cognitive behavioral therapy, talking to a therapist might help. Antidepressants, some antidepressants can help. And for the local vaginal symptoms, you can go to your pharmacy and there's a whole shelf just for different kinds of lubrications, moisturizers, all kinds of fancy stuff that you can buy at your local pharmacy that might help. This is just the company that we're discussing that has non-hormonal medication for all different kinds of menopausal symptoms, from hot flushes to vaginal dryness. So normally when a patient comes to me and tells me they're having menopausal symptoms, I ask them, what kind of symptoms do you have? Do you have like systemic hot flushes? And if you have those symptoms, then you need usually medication. Now, hormonal medication works the best. The non-hormonal medication that we discussed, like whether it's antidepressants or other medication, they only work up to 60% of the time, but hormones, they really work up to 80% of the time. And normally I like to give patches because patches have less side effects than pills. But if the patient complains, no, I don't have, or they're late menopause and they only have like real vaginal dryness just from lack of estrogen, I usually give them just some vaginal cream, some estrogen, or inserts that increase the estrogen and they rejuvenate, so to say, the vaginal area. So staying healthy during and after menopause. So as you reach the age of menopause, it's not only about lack of estrogen. You need to have better health. You need to be cognizant and think about better health. Eat a healthy diet. You need to start taking, if you're not taking already, you need to start calcium and vitamin D because your bones aren't as healthy as you were when you were younger. Definitely, you have to be physically fit and a healthy diet, and those are things that will help you through menopause. Limit and avoid alcohol, and studies show that smoking can worsen menopausal symptoms as well. Again, health after menopause, definitely increase your vitamins. Try, if you're smoking, try to quit smoking. But in general health, you want to see your doctor. You want regular blood pressure checks. You want your cholesterol and sugar checked. You want the bone scans because your bones aren't as healthy. After 40, we recommend breast screening um, and definitely follow yearly pap smears. And after 45, you need to start the colon cancer screening. So there's a lot of things that you have to take care of besides menopause. When to see your doctor. So usually I say see your doctor for your annual exam. If you're having any abnormal bleeding, meaning either you have heavy periods or you're having discharge, those are reasons to see your doctor. So normally when you go through menopause, you're going to have a lot of periods of not bleeding at all. And then all of a sudden the floodgates open and you're going to have heavy, heavy, heavy periods. And that can be very annoying to a lot of my patients. Normally, the best thing during these periods is to be on either some hormonal control, either it's an IUD or some other form that can help you through the menopausal stage so you don't have either heavy periods or spotting in between periods and that stuff. If you're having hot flushes, definitely talk to your doctor how to manage them. If you're having painful sex or you you have decreased libido, meaning, and I get a lot of patients who like they say, doctor, what should I do? My partner is complaining that I never want to have relationship and it's ruining my marriage. What can I take? What medicine can I take? So I get these complaints a lot. And there are things, there are medicines we can give, there are therapy that we can refer. There are things. So if you have those symptoms, you shouldn't ignore them. And definitely, if you have mood changes, we can treat all of these things. So those are reasons to see your doctor. And I left a lot of time for a lot of questions. So I leave the floor to you. And this is just a brief overview, but I'm happy to answer any questions that you might have.
Thank you so much, Dr. Kinrek, for this quick review. And yes, we invite all of our attendees to start asking questions. And we have, I have a few, but I have one here already. It says, does one need a prescription for that brand that you were talking about for the hormones?
You don't need a prescription.
Okay.
You can just call the company. You can look it up, Google it. It's bona fide, and you don't need a prescription. We have coupons that you can take. So, but otherwise, you do not need a prescription.
Mm-hmm. So let me ask you, when are hormones needed or other medications? Is it necessary or can you just go through all the symptoms of premenopause without needing any medication or any help at all?
Sure. So every patient is different. So, and again, it all depends on how bad the symptoms are. Some of my patients, they come to me and they're like, oh, okay, it's just a little bit of a hot flash, a little bit of an abnormal period, a little bit of spotting. I don't really want to take any hormones. I don't like them. And I'm worried about the side effects that the hormones can have. And they do just well with just lifestyle changes. Some of my patients are like, doctor, I can't work normally. I can't do my job. I can't sleep. My life is ruined. Please give me some medication. So with those patients, I counsel them effectively on the side effects possibly of hormone replacement therapy, and I tell them um, and I give them medication. But everyone is individualized, like I started. So there's no general rule who I give hormones and who I don't give hormones. And it also depends on what other risk factors you have, what other medical problems you have. If you're prone to having blood clots, if you're a smoker, if you're and every it also depends on how soon after menopause. So if you're just 10 years out, less than 10 years out of menopause, you're young, you're healthy, you have no medical conditions, and I'm like, okay, I have no problem giving you hormones. But if you're 80 years old and I just threw a number 80. It wasn't necessarily, and again, I give hormone replacement therapy to 80-year-olds too, as long as they understand the risks. And but with elderly patients, I usually try to give local vaginal estrogen. And the reason I do vaginal estrogen is because when you go through menopause, it's not like, again, you decrease estrogen, but it's not like you don't have estrogen at all. And by giving you vaginal estrogen, it only very your estrogen, your hormones is very decreased very little, and it doesn't go above menopausal range. So with elderly patients, I like to give local vaginal estrogen. Younger patients, I'd like to give patches and sometimes pills. It all depends.
Mhm. Tell us a little bit more about the side effects
So
of
there's
medications.
there's a big study that was done, Women's Health Initiative. And I
Mhm.
tried not to get into it because there's a lot of controversy with that study. And before that study, everyone got hormones.
Mhm.
Whoever was complaining of menopausal symptoms got estrogen, progesterone, they got everything. After that study, they did it with estrogen and progesterone. After that study, they showed that there's a little bit of an increase possible of blood clots, DVTs, strokes, heart disease, and possible breast cancer. But they didn't make the distinction really between younger patients and older patients and all their medical problems. So, so after the study came out, everybody got scared. Nobody got any hormones. And after a while, they did analysis of that study, and they had other studies as well, which they noticed that in the younger population, there's not really much risk. I mean, of course, there's risk because every medication has risk, but not as much as the study came out to be. With vaginal preparations, there is very minimal risks, and a lot of studies have shown that very little. So even with patients who have a lot of problems, I tend to be more lenient with vaginal estrogen. Now, the only population who I would not give vaginal estrogen is breast cancer, patients who have breast cancer or had recently breast cancer. Absolutely not. Someone who has active blood clots or recent blood clots, I wouldn't give um, any hormones. But if it wasn't recent, it's a old history, they would be candidates. But with breast cancer, I usually like to I refer them to the oncologist and get permission from the oncologist. And if they say it's okay, and with vaginal estrogen, they're more lenient. If it was a long history, like it wasn't recent breast cancer, they usually say yes.
Mhm. If somebody has heart disease or is using statins, would you recommend the patch or estradiol?
So the patch is definitely better than the pill in general because the patch it doesn't go through the liver, and it's a whole mechanism. I don't want to go into that. But for blood clots, the patch is definitely better. And again, we have to assess the risk. If there's a high risk above 10% of having a stroke or a heart attack, I wouldn't be comfortable prescribing that. Again, if you're a cardiologist or says it's fine and the patient is like, doctor, I understand the risk, but I just can't live life like this, is a different story. But I try not to. If there's a high risk of, I really try not to prescribe it.
Mhm. We have a lot of questions, believe it or not. So one is, what can we do if we are in perimenopause to prepare for the transition into menopause?
Excellent question. So in perimenopause, your periods start to become irregular. So when they become irregular, I usually like to give them, if they're not on birth control, I usually like to put them on birth control. Usually progesterones only, because they have less side effects than estrogen and progesterones. And that's I usually like the IUD because it has local effects, and that's to decrease your periods, and that's so you don't have problems when with abnormal periods. So that's an excellent way to transition. The other thing is your health, very important. If you're drinking a lot of alcohol, you're drinking a lot of coffee, you have to start limiting those. If you smoke, you have to try to stop quitting, because these are things that are going to make your menopause a lot worse. And I would recommend exercise and obviously the vitamins, very important, calcium and vitamin D. Usually I recommend calcium 1200 units, vitamin D 600 units, very important.
Mm-hmm. My question is another one of our attendees, that though I went through menopause on my own, my lifestyle interventions,
Mm-hmm.
with lifestyle interventions, I was surprised to hear that last year I was diagnosed with osteoporosis. Will hormonal treatment have helped not to get osteoporosis? I'm young, healthy, have a great lifestyle. Do hormones help with bone density? Isn't menopause normal and treatments are additional?
So normally, when you go through menopause, there's lack of estrogen, and the bones need that estrogen. The 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 To prevent osteoporosis is the FDA hasn't approved hormones to prevent osteoporosis, as far as I understand. So not necessarily for prevention. Once you have osteoporosis, the diagnosis, um, the there are many ways to treat it. I usually send my patients to the endocrinologist once we diagnose it. I usually diagnose osteoporosis with the bone scans,
Uh-huh.
and I start usually bone scans after age 65, unless the patient has high risk. And there's many high risk factors. They're having a lot of fractures, but except for calcium and vitamin D, I don't recommend hormones to preventing them. And again, because you go from normal bones to usually it starts with osteopenia. Your
Mhm.
bones start decreasing, and then it goes to osteoporosis. So it doesn't go straight from normal bone density to osteoporosis. So you have a little bit of a window. So in that window, I usually recommend calcium and vitamin D. But if I see it goes down and down and down, then I usually recommend to see the endocrinologist to see what medications to take to prevent that bone loss.
My doctor prescribed triamcinolone, acetonide, I hope I said it right. Also,
Yes.
estradiol cream. She really never shared enough information about both. What can you tell me about them? How safe are they, and how long can I use them?
So again, hormone replacement therapy. Um, Usually I tell them stop it when you can. So meaning even if I give it to you for hot flushes or vaginal dryness, I usually say, you start having these symptoms when you're, let's say 48, 50. I usually say, give it 5 years, see if you can wean off of it. And I don't recommend stopping abruptly, like going cold turkey, like from taking all the estrogen replacements and stopping it, because 30% of the time your symptoms will come back. So I recommend going gradually and seeing if you can wean off it. If you can wean off it, stop it as soon as you can. If you can't wean off it, then you go back to the regular dose. Now, I don't recommend it more than 10 years. Like that's, I tell my patients, try anything you can to get off it after 10 years. If you can't, you can't, and you understand the risks, that's okay. But if you can, you should get off it.
Mhm.
Now, um, the creams that she got was vaginal estrogen, and triamcinolone is a steroid. Steroid for short term is okay, but for long term, I do not recommend steroids for long term because it can break down the skin and it can cause permanent damage to the skin. So for short term, it's okay, but not for long term. And I'm talking about for a few months, it's okay, but not more. Unless after, if they need it more, I usually send them to a dermatologist and just to kind of to see if they need steroids. Now, as we discussed, every patient is different. There are patients who have vaginal diseases, such as lichen sclerosis. I don't like to call it a disease, but it's a vaginal disorder, lichen sclerosis, lichen planus, and other that require long-term steroid use. For, for them, you can have longer steroids. Again, I wouldn't recommend it every night or twice a day. And every patient is different. I recommend it, starting from every night, going down to once a week, twice a week. So sparingly.
Mhm. What is the protocol for simultaneous diagnosis of ADHD and perimenopause? And what is the best team approach when both occur?
So ADHD is again, I don't know if it's directly correlated with menopause. It could be that you have other mood changes, and that could can worsen your ADHD symptoms. But for ADHD, I definitely recommend seeing your um, specialist, your behavioral health specialist, social worker, and see what medications they can give you. But if you have depression specifically or anxiety specifically, studies have shown that antidepressants and anti-anxiety medication can decrease hot flashes by up to 60%. So it's not as good as hormones, but it's pretty good. 60% is pretty good. So those are, and the best medication for it that's FDA approved is Paxil. But off label, you can use Lexapro, other medications, and they have shown to have similar effects.
Mhm. Um, how does menopause affect heart disease, or how is it related to heart disease?
When you reach menopause, and again, it's a lot of patients ask me, doctor, I reached menopause, I can't lose weight, I don't know what to do. And And I tell them some of it might be related to menopause, but others, it might be related to just older age. And your metabolism doesn't work as well. And that's why it goes hand in hand, these things. So it's harder to lose weight, and then it worsens menopause, and then it worsens your overall condition, and then it can worsen your risks for heart disease and other diseases. So I don't know if it has a direct effect on cardiovascular disease, but it's definitely age is a predominant factor.
Um, we now see more and more women living longer and longer. So there are more women who are living with menopause.
Yes.
So why do we keep linking menopause with old age? It feels like now you're younger at 60 and 70.
Absolutely. And and interestingly enough, most of my patients who complain about menopause aren't the elderly patients. They're patients who are in the transition. They're in they're 47, 48, 51, 52, and they're going through, that's when they experience the most symptoms. They're having the hot flashes, they're going crazy, they can't sleep, and the vaginal itching, burning. Those are the elderly patients. Really, they don't complain much, and a lot of them aren't, again, sexually active, and they don't mind if they have a little bit of dryness. And so I would say, on the contrary, it's a disease of the mid age more than the older age.
Mm-hmm. Wow, that's very interesting to know. Now, you just mentioned hot flashes, and I think that obviously hot flashes is one of the most popular symptoms. How are they caused? Why do we get hot flashes?
Good question, excellent question. So hot flashes, they're doing a lot of research on it. Why we get hot flashes? Why intense heat? So, and they're trying to figure out ways to treat it. And what they noticed was the decrease, and again, everything goes back to estrogen. Decrease in estrogen messes around with your thermostat in the brain.
Mm.
And your body has trouble regulating itself from hot to cold. Now, there's targeted new treatments specifically for neurokinins that, and there's a brand name called Vioza that treats specifically that center, and that decrease the rate in hot flashes very, very, very good. The problem with that medicine is, as with every medicine, it has side effects, and you can have liver issues.
Mm.
So if you have any liver disease, you can't use that medicine. So you have to follow your blood work very closely with that medicine. But my patients that are on it are very happy.
Okay. So best solution is carry a fan with you.
Carry a fan, carry your sweater, your
A
you
bottle
know,
of water.
the water, and try to stay as healthy as you can. Take your vitamins, and but I like to say, if you need it, you need it. I always tell my patients this story. When when I did my residency training, my program director in the clinic, she was like, "Oh, don't give patients hormones. It has so much side effects. It's not good for your heart. It's not good for your brain. It's not good for this, not good for that." When she went through menopause, she's like, please, please give your patients everything. So it's just a change of perspective. Once you go through it, you're like, the side effects, aren't as bad as people make it to be.
Mhm.
So if you're going through menopause, please get help.
Mhm. And Dr. Kinrak, I think that one of the things that as women we struggle the most with is weight gain.
Correct.
Why do we start gaining weight?
So again, it could be estrogen related, your hormones, but it's probably a lot has to do with just your metabolism and age. And again, by giving you back hormone replacement won't make you lose weight.
Mm-hmm.
That's what giving you hormone replacement definitely will decrease your hot flashes, may help your mood a little bit. It may um, give you some vaginal rejuvenation, decrease the dryness, decrease UTI. But it's not going to make you really lose weight. So you really have to watch your diet, and if you need medications for weight loss, you can take them. But I, by giving you estrogen and progesterone, is not going to make you lose weight. A lot of also patients come to me and tell me, doctor, can you check my estrogen progesterone levels? Do
Mm-hmm.
I need to take hormones to replace the hormones that I lost? And I'm like, first of all, there's not blood tests that they're very not accurate to
Mm-hmm.
say, okay, you need to be at this level of hormone, and if you're a little bit less, we need to give you more hormones. It's very not accurate, these blood tests. It can only tell you really if you're menopause or not a menopause. It won't tell you the exact levels. And the other thing is, you only need enough hormones just not to give you symptoms. You don't need a whole bunch of hormones. And I think in the 1900s, or they thought by giving women lots and lots of estrogen, they can make them young forever, and they won't age. But we know now that's not the case. Giving estrogen is lots of it will give you just heart disease, strokes, breast cancer, blood clots, and all the good stuff, but the bad stuff, so to say. But um, it so the main goal of giving you hormones is just, so you shouldn't suffer. That's the main goal.
So if you're not suffering enough, you don't need medication.
Exactly.
We got another comment here. Dressing layers. Yes, that
Yes.
definitely will help. I am 69, and in my case, I lose weight. Why do you think is that?
Sorry, can you repeat?
Uh,
16.
I am 69, and in my case, I lose weight instead of gaining weight. Why is that?
So that's interesting. Um, Usually, I don't get that. And again, I would recommend going to your primary doctor, not OBGYN even, to see why you're losing weight. And if you're having, because a lot of and again, I'm not here to scare anybody. I'm not here, a lot of certain diseases come with weight loss and night sweats. And so if you have night sweats, doesn't necessarily mean that you're in menopause. If you have hot flushes, could mean your thyroid is wrong. It could mean something else is going on. So
Mhm,
definitely you need to get that checked out.
mhm. We have a little bit of time, Dr. Kinrack. Why don't we use that time to talk about mood changes? Because I know that a lot of people are like, oh, she must be going through menopause because she's in a bad mood. Like mood and menopause, well, they both start with M, but I think they might have a lot more in common. Like,
Correct.
why is that? Why the mood changes and how to go through that?
Right, right. So again, I get this a lot in my office all the time. They're like, doctor, please help me. Not just for me, just for my partner.
Yes, exactly. Cranky old lady. That's what I say. I'm gonna be a cranky
Right.
old lady one day.
They're like, I just can't control my mood. I don't know what to do. And again, if so, hormonal changes does affect your mood, and it affects it because again, you're not sleeping properly, you're bleeding a lot, you're having a little bit of bloating, your joints ache, everything is going, you're young and healthy, and all of a sudden everything is happening all at once, and you're not getting rest. You're not Your life is you feel like it's all over the place. And so a lot of that hormones, if you can decrease your symptoms, you won't have any hot flashes. You'll sleep better. Like if progesterone, if I use that as a supplement, you take it at night, makes you sleep better. That's why you take it at night. If you sleep better and you're good with your diet, with your exercise, you're going to be in a better mood. And another thing we discussed, if you're taking antidepressants, now there's a lot of stigma around antidepressants, but it's really not. It doesn't mean that there's something wrong with you. It doesn't mean that you're crazy. It doesn't mean. All it means is, and I tell my patients a lot, you can tell people you're taking the antidepressant just for the hot flashes because it really helps for hot flashes. So it decreases it 60%. So you don't even have to tell people you're taking it because of some mood disorder. You can tell them you're taking it just for the hot flashes.
Mm-hmm. Mm-hmm.
And so again, it's the mood has a lot to do with everything that's going on. And if you minimize the whatever is going on, you'll be in a better mood.
Mm-hmm. So how many marriages have you saved, though, Dr. Kimber?
A lot.
I bet you have.
A lot. And again, it goes back to also the they have vaginal dryness and they don't want to have sex. They just don't want to. They're like, it's painful and I don't know what to do. So for that, vaginal estrogen goes a long way. There's also intrarosa that we give, which is a vaginal insert that increases estrogen, progesterone, and there's a third hormone that it increases, also testosterone. Now, if you notice, I didn't talk about testosterone at all in the entire presentation.
Yeah, that's true.
And I do test for testosterone sometimes, and testosterone has used outside the United States. It used to be used in the United States as well, but the FDA removed their approval for using testosterone for increased libido, increased drive, sex drive. It definitely helps, but they removed the recommendation. And testosterone has a lot of side effects, so I do test for it. But if it comes back low testosterone levels, I don't replace it. I usually send them to the endocrinologist for testosterone replacement.
And is it true that testosterone is not covered by insurance for females, at least?
The problem with testosterone is that the FDA removed their endorsement, their recommendation. So if it's not FDA approved, the insurance companies might not want to cover it because they're like, it's not FDA approved. Why should we cover it? So that's why I like to test for it. If I can prove that they have a low testosterone level, and the endocrinologist might get some coverage for testosterone replacement.
Yeah. And you mentioned that some coupons. Where can they get them?
We have that in the office. If they come, ask it. Your general OBGYN should have it. And when you come for your next annual or your next follow-up, just ask us for it. I know at Hyla Medical, we definitely have it. I don't know about, I can't speak for other offices, but most offices I've been to have it.
And you can just say, I saw it in community chats with Dr. Kemp. Well, I think we're getting to let me see. Yeah, we're done with all the questions. So I think we are reaching out to the end. Thank you so much for answering all of our questions.
Thanks for having me. I really enjoyed speaking, talking about menopause. And more importantly, I'm happy I was worried that we won't be able to get through all the questions. I'm happy that we got through all the questions. So
we did, because you're very knowledgeable and it's very easy to understand you. So thank you so much for making it easy for us.
Thank you.
And again, to my attendees, I hope that you can join us next week again. We're going to be talking about stroke. and what to do in case of a stroke, how to prevent a stroke, everything about strokes. This is something that obviously, unfortunately, it could happen to us one way or another, or anyone around us. So don't miss a stroke next week, and enjoy the holiday weekend. And thank you so much again, Dr. Henrik, for being here.
Thank you.
Bye-bye, everyone.